Hello friends, I am Dr. Kapil Khandelwal, brain and spine surgeon. I have experience of more than 14 years and I have operated more than 5,000 cases of brain and spine. I am operating brain and spine cases through minimal invasive technique. This technique not only helps to early recovery of the patient as well as there is a less hospital stay and cost-effective treatment. As all we know that brain stroke is nowadays very common problem. It is not limited to a certain age group, but every age group patients are coming and presented with brain stroke. Today I want to discuss one of my operated patient, 34-year-old young male patient working in some IT company. He had history of sudden onset of slurring of speech. Later on he developed weakness of limbs and within few hours he became unconscious. When patient presented to us in the casualty, his condition was very miserable. We intubated him, put on ventilator and further investigation was done. MRI was showing there was a large left-sided cerebral hemisphere stroke. Unfortunately, when the patient presented to us, he was out of the window period and he was rapidly deteriorating. We offered the relatives about the brain surgery. Relatives agreed, gave consent to us. We operated patient on emergency behalf. Craniotomy was done. Patient was put on ventilator for next 3 days. Later on shifted to the ward and 14th day he was discharged. On the discharge, patient was doing all his activity by his own, but definitely he was having some weakness on the opposite side. After 3 months, patient again was called and the bone part which I removed in earlier surgery, that was put again, but this time we put the artificial bone and it was customized with 3D imprinting technique. It is the latest technique which exactly measure the bone defect and prepare the bone according to that. So it's the very good cosmetic result of this technique. Patient was operated and day 4 he was discharged. I will share very soon about the video of this patient and the relative statement about that. Now the patient is fully independent. He is doing all his work his own. There is some difficulty in his speech because as we all know the left side brain is a dominant hemisphere and speech area is in that. So it has damage because of that stroke. Otherwise patient is fully independent. He is doing all his work. So if the patient reached to us in time, we not only save the life of the patient but their life for in terms of his independence is wonderful. So morbidity is less and they can live their life in the perfect way. Thank you.